Welcome to the TubeClear system training video. In this video, we are going to learn how to set up and use your TubeClear system correctly. Please read the operator's manual before watching this video. Both reading your operator's manual and watching this video are required before using your TubeClear system. To get started, I would like to give you a brief background into the TubeClear system. The TubeClear system was developed to clear clogged feeding and decompression tubes at bedside while the tube remains in the patient. The TubeClear system works inside the feeding and decompression tube with a patented mechanical motion. The TubeClear system consists of a reusable control box and a single-use clearing stem. The control box moves a wire backward and forward inside of the clearing stem. This mechanical motion breaks up clogged material inside the feeding and decompression tube. There are different models of clearing stems for different feeding and decompression tubes, which I will refer to as tubes for the remainder of this video. There are clearing stem models available for gastrostomy, jejunostomy, and nasoenteral tubes, which include nasogastric tubes, all of varying lengths, French sizes, and materials. The first step in using your TubeClear system is selecting the correct clearing stem for your patient's tube. In order to select the correct clearing stem for your patient, you must first know the patient's tube characteristics. These include tube type, French size, and length. And for nasoenteral tubes smaller than 10 French, you also must know the material from which the tube is made. If you do not know any one of these things, stop and do not use your TubeClear system. It is important to know each piece of this information as each clearing stem has been designed to operate in specific tubes. Once you know the characteristics of your patient's tube, there are several tools available to help you select the correct clearing stem for your patient. These tools also indicate when you must know the material type of your patient's tube. The indications for use located in section 1 of your operator's manual tells you the specific use of each clearing stem based on tube type, size, and where appropriate material. There is also a table for each clearing stem model that visually displays the indications for use, and also on each clearing stem bag label. Also in the operator's manual, there are two TubeClear clearing stem selection charts for the purpose of step-by-step selection of the correct clearing stem based on the tube type, French size, material, and length. One chart is specific to NE and G tubes, while the other is for G and J tubes. I am going to demonstrate through 3 separate examples how to complete the first step in using your TubeClear system, which is selecting the correct clearing stem for your patient, based on your patient's tube characteristics. In these examples, I'm going to use the TubeClear clearing stem selection charts from the operator's manual to go step by step through each of the characteristics of your patient's tube to determine the correct clearing stem for use. In example 1, your patient Jane has a nasoenteral tube that has become clogged. It was determined by her chart that she has a 6 French nasoenteral tube that is made of polyurethane and is 38 centimeters long. Now we will go through the TubeClear clearing stem selection chart step by step, which again is located in section 4 of the operator's manual. Jane's tube tells us which chart to use. Since we know that Jane's tube is a nasoenteral tube, or NE tube, the TubeClear clearing stem selection chart for NE tube types will be used. We move to the next column after the NE tube type, which is French size. Jane has a 6 French tube, therefore we will follow the row for the 6 to 7.5 French to the next column, which is tube material. Since Jane's tube is made of polyurethane, we will follow the row indicated for PVC or polyurethane to the next column, which is tube length. Note there are 2 columns for tube length, one in centimeters and one in inches, as either can be used to identify tube length. Since there is only one option in this column, we will verify that Jane's tube falls within this length. Jane's tube is 38 centimeters, which does indeed fall within this range of 38 to 140 centimeters. So we will follow this row in the chart to decide which clearing stem model we should use. Note, a red X indicates that this clearing stem model is not appropriate for the tube characteristics, and a green check mark indicates that this clearing stem model is appropriate for the tube characteristics. For Jane's tube, the chart indicates that the TC1018 and the TC0812 clearing stem models are not appropriate for her tube characteristics. The TC0608 clearing stem model is appropriate for Jane's tube. Once we obtain the TC0608 clearing stem, we will confirm with the indication chart on the front of the bag that the characteristics of Jane's tube fall under this clearing stem's indications. And it does. Therefore, we have successfully selected the correct clearing stem model. Now, let's examine a second example and again select the appropriate clearing stem based on your patient's tube characteristics. In example 2, your patient John has a nasoenteral tube, or NE tube, that has become clogged. His tube is 10 French, PVC, and 91 centimeters long. We are going to use the selection chart in the operator's manual again to determine what clearing stem to use in John's tube. Since John has an NE tube, we will be using the TubeClear clearing stem selection chart for NE tube types. John's tube is 10 French, so we find the row that corresponds with this French size, which is 10 to 12. We continue along this row to the next column, which is tube material. Note, there are 3 options. We know that his tube is made of PVC, so we will follow the row that indicates PVC or polyurethane to the next column for tube length. Since John's tube is 91 centimeters, we will follow this row, and it tells us that both the TC1018 and TC0812 clearing stem models are acceptable. The TC0608 clearing stem model is not acceptable for use in John's tube. Now let's back up. If we did not know that John's tube was made of PVC, we still could have continued on. Note that there is any indicated for tube material. If we follow this row step by step in the chart, it would indicate that the TC1018 clearing stem model was appropriate. However, since we did know the tube material, we can see that both the TC1018 and TC0812 clearing stems are appropriate. Now we will examine a third example. In example 3, your patient Bill has a gastrostomy tube that has become clogged. His chart states that his tube is 18 French. However, his chart does not state the length or material of the tube. Looking at the TubeClear clearing stem selection chart for G and J tube types, you will see that tube material is identified as any. Since material type is not specific for G tubes, not knowing this piece of information is acceptable. However, knowing the tube's length is critical for all tube types, and since the length of Bill's tube is unknown, the TubeClear system cannot be used. I reiterate, for a G tube, you must know your patient's tube type, length, and French size. In this case, you do not know all the necessary characteristics. Therefore, you cannot use the TubeClear system. After selecting the appropriate clearing stem model that corresponds to your patient's tube characteristics, tube type, length, French size, and material, the next step is to set up the control box. There is a quick reference guide located in the bag with the clearing stem, labeled Directions for Use. This will be helpful to reference throughout the procedure. Each control box is delivered with a power cord, a power supply, an IV pole mount adapter with clamp, an operator's manual, and this training video. Remember to read the entire operator's manual prior to use, in addition to watching this training video. The first step will be to place the control box on a level surface or table, or use the IV pole mount to reduce the risk of the control box falling during use. If you're using the IV pole mount, secure the clamp onto an IV pole. Then, slide the receptacle located on the control box over the adapter on the clamp. until you hear the retaining button click. If you would like to remove the control box from the IV pole mount after the procedure, simply pull the retaining button out while simultaneously lifting the control box upward. We will be keeping the control box on the IV pole mount. Now, move the control box within 2 feet of the patient for comfortable use. Next, we will plug the power cord into the power supply. Then we will take the other end of the power cord and plug it into a standard wall outlet. Now, plug the power supply into the power jack located on the control box, being sure that the pins on the power supply line up with the slots on the power jack. The final step in setting up the control box is to ensure that the control box is operational. By turning the power switch to the on position, a green light should illuminate. If a green light illuminates, the control box is ready for use. If a yellow light illuminates, do not use the TubeClear system and follow the instructions in the operator's manual. After the control box is set up, we will need to set up the clearing stem. Remember, the clearing stem you select should correspond to your patient's tube characteristics. If you are unable to determine your patient's tube characteristics, tube type, length, French size, and material, do not use the TubeClear system. Before we get started with setting up the clearing stem, it is important to note that clean technique should be used throughout the procedure when handling the clearing stem. Therefore, do not allow the clearing stem to touch the floor or any other dirty surface. There are a few recommended ways to ensure that clean technique is used throughout the procedure. It is recommended that you wear gloves and safety glasses throughout the procedure, as you may come into contact with clogged content through the aspiration and irrigation steps. It is also recommended that you place a disposable pad over the patient's stomach and chest area to ensure that the clearing stem does not touch the patient or bedding. Third, when the clearing stem is not being used, it is recommended that it be coiled and placed back in its original packaging so that the clearing stem is out of the way during patency checks. There is a hole in the top of the bag for easy hanging on an IV pole. First, we are going to go over some important information about clearing stem setup. To start the setup of the clearing stem, you will need to recall the length of your patient's tube. The length of your patient's tube is important to identify because it will be used to determine the placement of the depth limiter. The depth limiter must be attached to the clearing stem at the location which matches your patient's tube length. Now I'm going to tell you exactly why placing the depth limiter correctly is important. Please be sure to watch my demonstration later very carefully. The depth limiter stops the insertion of the clearing stem as it does not fit into the tube's external port. When you properly set the depth limiter, the clearing stem is prevented from exiting the end of the tube. When you measure and place the depth limiter at a shorter distance than your patient's tube, the clearing stem cannot reach the end of the tube, and therefore you may not be able to clear all the clogged content. When you measure and place the depth limiter at a longer distance than your patient's tube, the clearing stem may exit the end of your patient's tube. Now back to setup. To demonstrate how to set up the clearing stem, we are going to go through 3 examples. In our first example, we are going to go back to patient Jane from the clearing stem selection. Using the TubeClear clearing stem selection chart in the operator's manual, we determined that TC0608 clearing stem was appropriate for Jane's tube. Now, remember, the first step in setting up your clearing stem is to recall your patient's tube length. Jane has a tube 38 centimeters long. Next, we will remove the items from the clearing stem packaging. We will set aside the directions for use and depth limiter. After we have removed the clearing stem from the packaging, we will hang the packaging on the IV pole. This will be used to help maintain clean technique as well as later for disposal. Now, remove the red magnet cover from the magnet adapter of the clearing stem. Place the magnet cover back in the clearing stem packaging, as we will use this later for disposal of the used clearing stem. The next step in clearing stem setup is to place the magnet adapter of the clearing stem directly in the center of the diaphragm of the control box, being sure that the red and blue tab is facing upward. If this is not facing directly upward, rotate the clearing stem so that the red and blue tab is in the up direction. Having this in the up direction will ensure easier removal of the component in a later step. Once the magnets of the clearing stem and control box have adhered to each other and the red and blue tab is facing upward, firmly clip the stem lock into the bracket adapter. You may need to push inward and then down to have this happen. Be sure to hear a clicking sound. To ensure that the stem lock is securely in the bracket adapter, tug upward on the clearing stem a few times. It is essential that the stem lock is securely in the bracket adapter for effective operation of the clearing stem. Next, remove the red and blue plastic protector from the clearing stem by pulling directly upward on the blue and red tab. This will release the plastic protector by breaking the blue tape on the opposite side of the plastic protector. Once you have removed the plastic protector, ensure that the stem lock is still firmly clipped into the bracket adapter. Do not operate the TubeClear system until the stem lock is securely clipped into the bracket adapter. Now that the clearing stem is securely attached to the control box, it is time to set the depth limiter to the length that matches your patient's tube. As I stated before, this step is very important for the effectiveness of the device. At the location at which the depth limiter is set will set the amount of clearing stem that is able to be inserted into your patient's tube. As a quick example, if your patient's tube is 127 centimeters, you want to set the depth limiter to 127 centimeters from the wire tip. You do not want to set the depth limiter at a location longer than 127 centimeters because this may allow for the clearing stem to exit the end of your patient's tube. You should also not set the depth limiter to a location shorter than 127 centimeters because this may prevent the clearing stem from reaching the location of the clog and decrease the chance of clearing the tube. In your patient Jane's case, the length of her tube is 38 centimeters. To set the depth limiter, you first need to remove the measuring tape assembly from the plastic sleeve. The measuring tape has a centimeter and an inch side. For this patient, you want to use the centimeter side since Jane's tube is 38 centimeters. Cut or tear the measuring tape at a location that is equal to your patient's tube. Since Jane's tube is 38 centimeters, we will cut at the 38 centimeter mark on the measuring tape. Now, the attached measuring tape is equal to the length of Jane's tube. Next, remove the brown backing from the depth limiter. Set the depth limiter aside so that it does not adhere to anything. Since the clearing stem is secured into the bracket adapter, the control box will help hold one end of the clearing stem. This will allow us to release some of the slack, being sure not to touch any dirty surface with the clearing stem, so that we are holding the clear wire tip protector. Verify that the wire tip is lined up with the 0 mark on the measuring tape. If this is not so, slide the clearing stem in or out of the wire tip protector until the wire tip is aligned with the 0 mark on the measuring tape. This is important as this provides the correct starting point for measuring the placement of the depth limiter. Now that our measuring tape is cut to the length of our patient's tube and the wire tip is lined up with the 0 on the measuring tape, we are ready to set the depth limiter. Hold the clearing stem and measuring tape tightly together. Slide your hand along until you've reached the end of the measuring tape. Be sure that there is no slack between the measuring tape and the clearing stem. This is to provide an accurate measurement for the depth limiter. Now I will change positions to make this easy to see. Again, being sure that there is no slack between the clearing stem and measuring tape, I will hold the measuring tape in place. I will line the bottom of the depth limiter up with the cut portion of the measuring tape and place this centered on the clearing stem. Now that the depth limiter is centered on the clearing stem at the location that equals our patient's tube, we will simply fold the depth limiter in half and hold for 5 seconds. Now as you can see, the depth limiter is located at the exact length equal to our patient's tube. The next step is to remove the wire tip protector and discard. We are now ready to use our clearing stem. Also, be sure to complete the checklist located in both the operator's manual and the directions for use to ensure that all necessary steps have been completed before operating your TubeClear system. Is the clearing stem attached to the control box with the stem lock firmly clipped in the bracket adapter? Is the depth limiter attached to the clearing stem at the location that corresponds to your patient's tube length? Has the clearing stem been removed from the clear wire tip cover? Now that we have successfully completed setting the depth limiter to equal your patient's tube length, I'm going to go through 2 more examples on how to do this. In this example, your patient has a G tube that is 14 French, made of PVC, and is 10 inches long. Therefore, by using the TubeClear clearing stem selection chart for G and J tube types, we can determine that the TC 1018 clearing stem model should be used. Now let's set up the clearing stem. Remember, the first step is to recall your patient's tube length. In this example, it's a 10-inch tube. Remove the components from the clearing stem packaging. Set aside the directions for use. Remember, this is a good reference to use throughout the procedure. Also set aside the depth limiter. Once you've removed the clearing stem from the packaging, hang the bag on the IV pole. This will be helpful for clean technique. Remove the red magnet cover and place in the packaging. Attach the magnet of the clearing stem to the control box, being sure that the red and blue tab are facing directly upward. Clip the stem lock securely into the bracket adapter. Verify that it is secure. Remove the red and blue tab by pulling directly upward. Now we remove the backing from the depth limiter. Set your depth limiter aside to ensure that it doesn't adhere to anything. Remove the clear plastic sleeve from the measuring tape assembly. Now we will cut the measuring tape at the length that equals our patient's tube. In this example, it is 10 inches. Note that there is a centimeter and inch side. Be careful not to damage the clearing stem while cutting the measuring tape. Once we cut the measuring tape, we will line up the wire tip to the 0 mark on the measuring tape. If the wire tip is not already lined with the 0 mark, slide the clearing stem in and out of the wire tip protector until the wire tip is in line with the 0 mark. Hold the measuring tape and clearing stem tightly together. Being sure that there is no slack, slide your hand down the clearing stem and measuring tape until you reach the end. Line the bottom of the depth limiter up with the measuring tape. Center it on the clearing stem, fold in half, and hold for 5 seconds. Now remove the wire tip protector from the clearing stem and discard. For our final example, I am going to start with the clearing stem already attached to the control box and the brown backing removed from the depth limiter. In this example, your patient has a nasoenteral or NE tube that is 8 French, 140 centimeters long, and made of PVC. Using the TubeClear clearing stem selection chart for NE tube types, we can determine that either the TC0812 or TC0608 clearing stem can be used. In this example, I've chosen to use the TC0812 clearing stem. I have previously executed the steps in attaching the clearing stem to the control box and removing the brown backing from the depth limiter. Now it's time to cut the measuring tape to equal the patient's tube length. In this example, it's 140 centimeters. Being sure that I am on the centimeter side of the measuring tape, I will locate the 140 centimeter mark. I will cut the measuring tape at the 140 centimeter mark. Now I will be sure to line up the wire tip with the 0 mark. Once the wire tip is lined up with 0, we will place the depth limiter. Because this is a longer length, your arms may not be long enough to do this comfortably in one step. Therefore, the following 2-step process will be helpful. Hold the clearing stem and measuring tape tightly together. Slide your hand along the length, about halfway or whatever's comfortable, and firmly grip. Be sure that there is no slack between the measuring tape and the clearing stem. Once you have secured the measuring tape so that it cannot move, reposition your other hand. Once you've repositioned your hand, slide the other hand along the remaining length of the measuring tape, again, being sure that there is no slack between the measuring tape and the clearing stem, until you've reached the end of the measuring tape. Once you've reached the end of the measuring tape, firmly grip the clearing stem and measuring tape so that the measuring tape cannot move. Once this is secure, we will grab the clearing stem. Since there is so much length, it is important that we maintain control so that the clearing stem does not touch any dirty surface. Once I've repositioned the clearing stem, being sure that the measuring tape did not move, I will place the depth limiter. Center the depth limiter on the clearing stem so that the bottom lines up with the measuring tape. Fold the depth limiter in half and hold for 5 seconds. Now we have successfully placed the depth limiter on the clearing stem at 140 centimeters, which is equal to our patient's tube length. Now it's time to remove the wire tip protector and discard. Now that we have completed 3 examples on how to set up the clearing stem, we will go through steps on how to properly use the TubeClear system to clear clogged tubes. To demonstrate how to use the device, I will be clearing a simulated clog in a 14 French, 122 centimeter long tube that is made of PVC. I will be using the TC 1018 clearing stem model, as this is the appropriate clearing stem to use based on these tube characteristics. For this demonstration, I have already set up the control box and the clearing stem, and I have placed the depth limiter at 122 centimeters from the clearing stem's wire tip. To show you how the device works, I'm going to use a clear model so that you can see how the device breaks up a clog inside the feeding tube. While handling the clearing stem throughout the procedure, you may loosely coil it around your hand to help control the clearing stem's length. However, do not tightly coil the clearing stem around your hand or finger before or during use, because this will slow the wire motion and decrease effectiveness. If you wrap too tightly, you will need to get a new clearing stem, as it will kink and not work. To operate the TubeClear system, hold your patient's tube port in one hand while holding the clearing stem in the other. Holding your patient's tube allows for better control while inserting and removing the clearing stem from the patient's tube. Insert the clearing stem into the patient's tube a few centimeters. Press the Start-Stop button on the control box. Manually advance the clearing stem until you encounter resistance from the clog. Work on the clog using varying speeds of backward and forward motions. It is important to use backward and forward motions when moving the clearing stem through the tube, because it will further help to break up and spread the clog content throughout the tube. For clogs you suspect are caused by medication, it is usually helpful to use quick, short forward-backward strokes. For clogs you suspect are caused by feeding formula or soft materials or feel sticky on the clearing stem, it is usually helpful to use long forward and backward strokes. However, do not apply excessive force on the clearing stem, as this may kink the stem. Any sign of kinking due to your applied force will decrease the effectiveness of the stem. Now that I feel resistance from the clog, I'm moving the clearing stem backward and forward, trying to spread out the clog content while advancing into the clog further and further. You can see through my forward and backward motion that the clog has went from a concentrated shorter distance to be spread out through a further distance along the tube. If I have not easily made it through the entire clog in 1 to 2 minutes, meaning that I can advance my clearing stem until the depth limiter touches the external port, I will back the clearing stem in a controlled manner slowly out of the patient's tube so that I may aspirate and flush the content. Flushing with liquid and aspirating throughout the procedure helps to break up and spread out the clog and remove any declogged contents. Therefore, be sure to flush and aspirate every 1 to 2 minutes if the clearing stem is not easily advancing within the tube. To remove the clearing stem, hold the tube with one hand and slowly retract the clearing stem with the other hand. Allow no more than 10 centimeters or 4 inches between your hand and the tube's external port. If you allow a larger distance between your hand and the tube's external port, you may be introducing extra force onto the clearing stem, which may damage the clearing stem. After removal of the clearing stem, stop the control box by pressing the Start-Stop button. Do not detach the clearing stem from the control box at this time, as you may need to reinsert it into the tube if the clog is not yet clear. Place the clearing stem back in its packaging or use another clean technique while flushing and aspirating the tube. Flush and aspirate with an enteral syringe. If the clog does not clear during your attempt to flush and/or aspirate, reinsert the clearing stem into the tube and repeat the use of the TubeClear system until the clog is gone or the depth limiter reaches the tube's external port. Be sure to use backward and forward motions when moving the clearing stem through the tube. If the clog is not removed within 10 minutes, refer to the troubleshooting guide of the operator's manual. Also, note in some cases the clearing stem will advance through the clog, but the tube will not clear during the flushing and aspiration steps. This is commonly the result of the clog content reforming during the flush. If this occurs, simply reinsert the clearing stem and repeat use of the TubeClear system. Also, for more difficult clogs, it may be necessary to aspirate and flush throughout the clearing procedure several times before the clog is cleared. Perform the following in accordance with your institution's protocol. Verify that your patient's tube is properly placed. Flush and aspirate the loosened clog contents out of the patient's tube. Verify that your patient's tube is clear. After verifying your patient's tube has been cleared, disconnect the clearing stem from the control box by unclipping the stem lock from the bracket adapter. Gently pull upward on the clearing stem to remove the magnet adapter from the control box diaphragm. Replace the red magnet cover on the clearing stem's magnet adapter before disposing. This will ensure that the magnet does not adhere to anything during disposal. Dispose of the clearing stem as regulated medical waste in accordance with government regulations and your institution's protocol. The clearing stem is a single-use device. If any of the declogged contents from your patient's tube comes into contact with your patient or any surfaces, consider the declogged contents to be similar to vomitus. Clean your patient and surfaces in accordance with your institution's protocol. Also, refer to the operator's manual for instructions on cleaning the control box after each use. Make sure that you have read the operator's manual and fully watched this video prior to using your TubeClear system.